You should by now have already seen the first video discussing what ambulatory care is. In that video, we explain that it's crucial to be able to return to the hospital in the event of a temperature or other symptoms. That's why we need patients to be able to return to the hospital within an hour of reporting any problems. Some people don't have the transport to be able to return that quickly, or they live more than an hour away. In these cases, patients can stay in accommodation right here on the hospital site and still have the benefit of ambulatory chemotherapy. This accommodation is called Rosemere House. This is a 4-bedroomed house situated directly opposite the entrance to the Accident and Emergency Department at Blackpool Hospital. Rosemere House opened in December 2023 thanks to the kindness and generosity of Rosemere Cancer Foundation and Blue Skies Charity, the local hospital charity. We must also pay tribute to the many fundraisers who thanklessly dedicated their time and energy in fundraising, without which the accommodation would not have been possible. The house consists of 4 ensuite bedrooms. Each bedroom has a shower and toilet, along with smart TV and Wi-Fi. The 2 bedrooms downstairs are for single use, the upper 2 bedrooms are for shared use, so a patient can stay with their partner or spouse. Bedrooms will be allocated on the basis of clinical need and expected length of stay in the house. Patients cannot choose individual rooms. There is a fully fitted shared kitchen with a washing machine and tumble dryer. There is also a relaxation room at the rear of the property with couches, dining table and smart TV.
As explained in the ambulatory care video, this is ideal for patients who would be suitable for ambulatory care but either don't have transport to return quickly to the hospital or live more than an hour away. All rooms have individual locks. Each room has one key that opens both the front door and the door to that individual room, but no other bedrooms. The key also opens the relaxation room at the rear of the property. The best way to think of Rosemere House is like a self-catering apartment or a self-catering cottage. Some equipment will be provided, but it may be helpful for you to bring some items to make your stay more pleasant. In the kitchen, each room has its own cupboard which has a lock. You can store food here and each cupboard has its own set of crockery. Within the kitchen, there is an electric oven, hob and microwave. There's also a kettle and a toaster, and tea, coffee and milk are also provided. There is a fridge with a separate freezer. In terms of catering facilities, each patient will be allocated a meal voucher in the hospital canteen for 3 meals per day. We're afraid that the vouchers are only for patients and not relatives. The hospital canteen is located within the main hospital building, only a 5-minute walk away. If you're attending the ambulatory unit during lunch or dinner, you will be offered a meal during these times. You can bring your own food to Rosemere House. You can even shop at Marks and Spencer's within the hospital, or you can get food delivered. Within each bedroom, there is an internal hospital telephone. The ambulatory unit can be contacted within their opening hours. The haematology ward is always contactable outside of these hours.
All patients staying in Rosemere House will be seen every single morning on the ambulatory unit. At each visit, you will have a full set of observations performed and the nurses will ask you about any symptoms you may have. You may need to see a doctor if any of the symptoms are concerning. This process is repeated in the afternoon with each Rosemere House patient coming back to the ambulatory unit between 5 and 6 p.m. Finally, you will be expected to call the haematology ward around 8:30 p.m. each night to make sure all remains well. The ward nurse will ask you a few questions and then plan to review you back on the ambulatory unit the following morning. And now, here's one of our patients, David, who recently experienced Rosemere House.
My name's David. I have a history of chronic myeloid leukemia. This has progressed to AML, and I am now, after 6 months of treatment in Blackpool Hospital, I am now in remission, and I'm going to Manchester for my stem cell transplant. So I was in a side room at first for my first lot of treatment, and although this was good and excellent care, but I found the downside was there was a lot of noise. I couldn't get any sleep, constant noises through people doing their jobs, whether it was cleaning the floors, emptying the bins, and constant, pressure doing the obs and things. I found it difficult to sleep. I was very pleasantly surprised when I came into Rosemere House. I was able to use the house, and the first day I came in, I was sat on the swing. I was eating my sandwiches. It was really nice, sat in the sun, really relaxed. I was able to go walk to and from the hospital because it's just across the road. I could walk out after I had my treatment, so I'd go in at an allotted time. I'd be given a time to go in to have my obs done, my checks and what I needed, if I needed any treatment. But then after that, my time was my own. I could go for a walk, I could sit in the garden, read a book. I just had time to myself. We actually did walk into Stanley Park, and it was really nice, really lovely there. Walking to and from Rosemere was, for me, was the thing that helped me progress, helped me to get better, I think. It aids your recovery, so I wouldn't worry about it. I'd actually think it's a positive, and being able to stay with your partner, and is a real advantage. For me, it worked for me, and I wouldn't worry about it at all. I'd happy to recommend it. It's a really good resource. I want two things. I want Liv to be able to do my bone marrow biopsy in Manchester, and the other thing was I want permission to come back and ring that bell when I'm finished. Right.